Vaccines can be our first line of defense against a number of infectious diseases. And that's why Medicare allocates a significant portion of its annual budget towards vaccines, almost $5 billion this year. In this video, we're going to look at exactly who decides which vaccines are going to be covered, why they're covered, and how much they'll cost you. Now, in order to understand how Medicare is going to cover vaccines, you have to understand the Medicare system, because a couple parts of Medicare will be responsible to cover your vaccination. So let's go real quickly and do a brief review of the different parts of Medicare. So Part A, we refer to this as the inpatient care of Medicare. So this means if someone is put in the hospital, Part A is going to be paying the bills. If someone goes to a skilled nursing facility, maybe after a stroke or a hip replacement, again, Part A pays the bills. Here, we also have hospice. So this is someone that's been diagnosed with a terminal illness, 6 months or less to live, and they're on hospice. It's Part A, again, that's going to pay for that. And also, we see medications are covered by Part A. Why? Because you're in a hospital or skilled nursing, more than likely you're getting medications. And so Part A is going to cover those meds during that hospital or skilled nursing stay, or during your hospice care as well. All right, now let's take a look at Medicare Part B. Part B is pretty much the outpatient side of Medicare. This is going to be any kind of outpatient surgery, your labs, your MRIs, those kinds of things you do outpatient. This also covers Part B, all doctor services. And what this means is if someone goes to see a doctor, Part B is going to cover the bills for that. Or if a doctor takes care of you in the hospital, this would be hospitalists, ER doctors, surgeons, anesthesiologists. The point is all doctors are paid through Medicare Part B. Also, we have home health care. So when someone they've had, let's say, a knee replacement, and they go home for that treatment, it's the home health care bills are going to be paid through the B of Medicare. Also, durable medical equipment. This would be CPAP machines and oxygen equipment and diabetic supplies and those kinds of things, again, paid through Medicare Part B. As well as all your preventive services are going to be covered through Medicare Part B, and Medicare Part B also covers medications. So if I had an outpatient surgery, certainly I'm going to have some meds during that surgery. But the meds that are covered through Part B are also designated as professionally administered medications, so that you get these in an outpatient setting, by a provider. So meds are covered under Part A, just like they're covered under Part B. But again, they're professionally administered. Also, here's what happens: because vaccines are considered to be preventive, vaccines are going to be covered. Some of the vaccines are also going to be covered by Medicare Part B, because again, it's that preventive portion of our coverage. All right, so that is Part B. Now, Part C plans are called Advantage plans. Medicare Advantage plans, a private health insurance company that replaces Medicare for you. And so what happens here is that Advantage plan is actually going to match Part A and B. All right. Now, the coverage could be a little bit different, but as far as the services covered, which of course we're talking about now, are going to be your vaccines, are also going to be part of that Advantage plan coverage. Now, when it comes to Part D plans, this would be for our self-administered medications. Remember here, these are all professionally administered meds. Here, these are my self-administered medications. So I have a cholesterol medication or high blood pressure medication or maybe insulin, those kind of things that you self-administer, covered by Medicare Part D. But also what we have here, we have some vaccinations. So we have some vaccines also covered under Part D. So some are covered under B, some are covered under Part D. Now, if we have an Advantage plan, again, they're going to match that as well, because sometimes people get an Advantage plan and the MA part, Medicare Advantage, is matching our in and outpatient, but then we add a prescription drug plan, and again, they're going to cover those vaccines here and those vaccines here. Now, if someone has A and B and has a supplemental plan, then they get what we call a standalone Part D plan. And again, that standalone Part D plan is going to cover some of the vaccines as well. So that's the breakdown of our coverage. Now let's get into the specifics of what we covered by Medicare as it relates to vaccinations. All right, that brings us now to the subject of this, and that is who decides what vaccinations are going to be covered. Okay, and so here is the way our government works when it comes to vaccinations. The Center for Disease Control and Prevention, which you and I would know as, of course, the CDC, is the one ultimately that's going to be responsible for deciding. However, what they've done is they have delegated this out to a different agency, and it's actually called the Advisory Committee on Immunization Practices. So very important part that this group is going to play in determining vaccinations that's covered. So the ACIP. And so let me show you the process of what happens with ACIP. So first off, there are actually 55-member panel within the ACIP that makes these decisions and recommendations. And so here's the breakdown. First off, what we have 19, notice this, voting members. So ultimately, it's going to be these voting members that are going to decide this and make the recommendation, of course, eventually to the CDC. But there's 19 voting members, and I thought you may find this interesting. What happens with these 19 voting members is this. The Secretary of the U.S. Department of Health and Human Services, of course, right now that would be Robert Kennedy, selects these members following an application and nomination process. Now, of these 19 people, here's kind of the criteria. Number one, they are independent medical and public health experts. They do not work for the CDC. Now, of these 19 voting members, there's one, though, that's a little bit different, and that's this. This is a representative who provides perspective on the social and community aspects of vaccination. So this would be, of the 19, one would have more of a consumer advocate type of a role. All right? And so that's the 19 voting. But again, we have 55 members. So what's going to happen next? Then they appoint an additional 6 different members who are parts of the federal government that also have some direct relationship to how vaccinations are going to be administered. All right? And so these 6 officials, again, not voting, but they're responsible for immunization programs within the federal government. And then we have, notice here, 30 other experts. All right, and so again, non-voting members, but still part of the panel. And these non-voting representatives are liaison organizations that bring related immunization expertise to the panel. So again, 30 that are well-versed with vaccinations, certainly experts in the field. So these 55 people are the ones that are going to make the recommendation that will then decide what vaccinations are covered. All right, and they meet 3 times a year. I think it's February, June, and October to make these determinations. So the whole point of me showing this with you, I want you to make sure that you know this is a process that's followed. So any vaccination that's recommended by the ACIP then is going to be covered by either Part B or Part D. Now, as we get into the specific vaccines that are going to be covered by Medicare, I thought this chart here would really kind of help you to understand the process that's involved here. So there is a difference between a vaccine and an immunization. Now, we use those oftentimes interchangeably as though they're synonymous, but they're really not. So I hope this will clarify for you what we're trying to teach in this video. So first off, a vaccine is actually a substance. Obviously, this is some kind of a medication, a substance, a drug. This could be inhaled, it could be taken orally, or of course, it could be injected as well. And so what's happening, though, is we're taking this substance, and the purpose we're doing this is to build this immunity within our system against that disease or that infection. And so this is the process of building that up, the antibodies within our body. So we give the med, and the process is we have this immunization that is then going to occur, immunity. And then also we can look at this as a vaccine is the tool that we're using, and this is actually the outcome. We hope now to be immune to that particular disease or infection. All right, so I thought that was very helpful. So the substance stimulates an immune response, and then the process in developing immunity after the vaccination. All right, now let's get into the specifics. We're going to begin by looking at the 4 vaccines that are covered by Medicare Part B. And the first one, of course, would be the influenza vaccine. Of course, we just simply call this the flu shot. All right, and so what is influenza? Well, here's the definition. This condition is a contagious respiratory illness that's caused by influenza viruses, primarily Part A and Part B of the virus. And so why is this such a troubling issue? Well, a lot of complications. It affects the nose, the throat, the lungs, and also can result in pneumonia, bronchitis, very serious, of course, among seniors. And then notice this, an exacerbation of chronic illnesses. So if someone has some type of a heart failure or maybe asthma or something, again, if they get influenza, it's going to exacerbate that and could, of course, lead to a lot of complications. All right. And so also very, very expensive. Right now, the cost of treating Medicare patients to actually get influenza is $11 billion per year. That's why they, of course, would like to see people get the vaccine because they can avoid these expensive costs just for treatment. And then you'll notice here the average hospital stay for treating flu right now is $12,000. And really one of the saddest facts is this. They say right now that on the average, we have about 15,000 seniors, Medicare eligible people that die from influenza on an annual basis. All right. And so if you get the flu shot as a vaccine, what happens? Well, it's 100% covered by Medicare. Notice Part B. Part B is going to cover. It's one of the four that they're going to cover. And you're going to notice that they cover it one flu shot per flu season. We have two flu seasons, one in the wintertime and then one, meaning as we approach the fall, winter, and then one in the winter season. So someone actually could get two of those in a year if necessary. Okay, and so, but what happens with this Medicare Part B, notice it's going to be covered at zero out of pocket to you. There's no cost to you as long as you're going to a Medicare approved provider, or if you're on a Advantage plan, you're going to someone within their network. There's no out-of-pocket cost for you, no co-pays, no co-insurance at all. All right, so that is the flu vaccine. Now, just before we get into the second vaccine that's covered, I just would encourage you, if you would like to stay up to date with everything related to Medicare, as well as Social Security as well, one of the best ways to do this is actually subscribe to our channel. There's no cost involved at all, so you'll see right below here a place for you to subscribe. And every time that we do a new video, which is usually one or two a week, we actually notify you about the new content. We also appreciate if you wouldn't mind just give us a thumbs up. That helps our channel for sure to let others know about us. And then as well, we love comments. If there's something that you would like to comment about, the good constructive criticism is certainly fine as well, but something that you would like us to cover. We look at all the comments and respond to as many of those as we can. All right, let's get back to the vaccines. So the second vaccine here is going to be the pneumonia shot, pneumococcal pneumonia shot. And so I'll give you some details about pneumonia that I think you need to understand. First off, what is it? Well, the health condition of pneumonia is actually a lung infection that actually inflates the air sacs in one or both lungs, causing them to fill up with fluid or to actually fill up with pus. All right, so very, very serious health condition. And so the complications, again, respiratory failure when people get pneumonia, sepsis, again, very dangerous, chronic lung damage as well. And so very concerning when people get pneumonia, especially Medicare age. High cost of treating people that get pneumonia annually. You notice $13 billion a year Medicare spends on pneumonia treatment. And notice this average hospital stay for someone that has pneumonia is about $15,000. But probably one of the saddest statistics is this. They say right now about 50,000 people annually, seniors, are dying from pneumonia. So very serious, and that's why, of course, the vaccine is very important and helpful. Again, it's going to be covered by, notice, Medicare Part B. It's one of the four covered by Medicare. And again, notice here it's a one-time vaccine given in two separate shots, and of course, both of those, the first shot and the booster as well, covered by Medicare. And again, no cost to you whatsoever, covered by Medicare B. And if you're on an Advantage plan, again, part of that coverage as well. Again, you got to have to go to a Medicare approved provider or see a network doctor if you're on an Advantage plan. All right, so that's the pneumonia shot. All right, that brings us then to the third vaccine, which is hepatitis B. Now, I want to clarify something. I think it's real important because there's actually two types of hepatitis, A and B. All right, and so both of these are going to be covered by Medicare, but differently. The hepatitis B will be covered under Part B. Hepatitis A is actually covered by Part D plans. All right, now, I also want to show you this as we look at the details of this disease. There's actually medication that's a combination treating A and B, and that is called Twinrix. And because it has A and B in it, what happens, it's actually covered by Medicare Part D plans. So if I was only going to get the hepatitis B vaccination, that's going to be covered under Medicare Part B. But if I do that combination, this is actually a medication that's taken in 3 different dosages, again, combining A and B. All right, let's keep going. Now let's talk about the differences between hepatitis A and B. I think this is very interesting. Number one, hepatitis B, notice it can be acute, meaning short-term, or can be chronic, and normally is chronic. When it comes to hepatitis A, really not fatal. It is acute. Almost always people can recover from hepatitis A. Now, let's talk about how it's spread, this infection. Number one, it is highly contagious for sure. It's spread through blood, semen, or other body fluids, or when people share needles, because of illegal drugs, or at childbirth. So if mom has hepatitis B, then oftentimes the child is going to get it as well. All right. Now, when it comes to Hep A, notice the transmission is from fecal to oral, and that comes primarily through contaminated food. Very common that way, of course, dirty water or poor sanitation. All right, so that's the way it's going to travel. All right, so let's focus now primarily just on the Hep B, because again, that's the one very, very dangerous. And again, not minimizing Hep A, that's serious for sure. But Hep B, let's talk some details about that. What is it? Well, the health condition is this. It's a viral infection that affects the liver and can cause, notice, severe long-term liver damage if not treated properly and in time. All right? And so when it comes to complications, it can develop, of course, certainly cirrhosis of the liver. You can have liver cancer, liver failure, kidney disease, and even death. Okay, and so we know it's a very, very serious situation. Now, the cost of actually treating Hep B right now is $2 billion per year. Now, notice this, the average medications, because that's how it's going to be treated once someone has it, somewhere between about $2,000 to $12,000 per year, depending upon the type of medication that's being used. So again, very, very costly situation as well. And then the coverage with the hepatitis B, again, covered by Medicare Part B. Remember, we said we have 4 primary vaccines covered by Medicare Part B. This is the third of the 4. And again, it is going to be covered at 0. But notice this, very important. It's covered for those that are at a medium or high risk. So it's not going to be covered for everyone unless you fall into this risk category. Let me show you the categories here. First off, anyone that has end-stage renal disease. Certainly, they are very susceptible to Hep B because of the blood and everything. Anyone with hemophilia, those living with hepatitis B carriers. So if you're married to someone that has Hep B or live with someone that has Hep B, certainly you could be exposed to that and need that immunization, that vaccine, or those who use certain injectable drugs, healthcare professionals who frequently control and are in contact with blood or other bodily fluids. Again, they'd be very susceptible to this, and so that would be covered by Medicare Part B at 0 cost. All right, and then don't forget we talked about the twin rakes. If we want to do the Hep A and Hep B, we can certainly do that as well. Okay, so I know the hepatitis B shots, I think it comes in 2 doses as well, and again would be covered by Medicare. All right, that brings us to the 4th primary vaccination covered by Medicare Part B, and that's going to be COVID-19. Obviously, we're all familiar with what COVID is. Of course, shut down our economy, had terrible consequences for people's dying, and just very, very sad time in our country and really in the world. And so very serious as well. And so the cost right now is $2 billion per year as far as treating those that get COVID. When someone is hospitalized because of COVID, the cost right now to Medicare is about $21,000. And of course, we can get COVID vaccinations for sure, a primary one, and then boosters. And then the cost right now is about $45. Not your cost, but I'm saying that's the money that's being spent right now for the different manufacturers of the COVID vaccines. They're getting about $40 to $45 from the federal government. So the whole point is $2 billion, very, very expensive. And so are you covered for the original COVID shots as well as the booster shots? And the answer is yes. And again, this is also covered by Medicare Part B. And again, it's going to be a 0 cost to you as long as you're seeing a Medicare provider or on a Advantage plan. They will cover it as well as long as you see a provider that's going to be within the network. All right, so no cost whatsoever. Now, also, I want to talk about testing because this is also very important. This is something that changed. When we were going through the PHE, the health emergency that was going on, there were different rules, but they changed the rules back in May of 2023. And so let's be clear on what is covered and what's not covered as it relates to COVID testing. Notice here, testing is covered still today at 100% when that test is ordered by a physician or other practitioners. All right. Now, prior to this, Medicare was covering home test. but that again changed in May of 2023. But right now, as long as doc says yes, we need to order that test because we think it could be COVID, then again, Medicare is going to cover that through the preventive of Medicare Part B. Original Medicare does not cover over-the-counter test as of that particular date. All right, so I want to make sure that you know we still have coverage with COVID, but it has changed just a little bit. All right, so that was the 4 vaccines covered by Medicare Part B: flu, pneumonia, the hepatitis B shot, as well as COVID vaccinations. All right, now let's talk about some other vaccines covered by Medicare, and again, a different part of Medicare. And this would be the RSV vaccine. All right, this stands for respiratory syncytial virus. A very, very serious situation when people get RSV, especially at our age. And so the health condition is a highly contagious virus that infects the respiratory tract, your bronchioles and your lungs, affected by RSV. Now, when it comes to complications from RSV, you'll notice pneumonia, bronchitis, and exacerbation of chronic illnesses. So if someone has COPD, that chronic obstructive pulmonary disorder, they have congestive heart failure. It's just going to exacerbate that and really can easily lead to death. And so right now, there's anywhere between 6,000 to 10,000 deaths per year because of the RSV problem that exists among the senior population. So again, something highly contagious, very serious. The cost right now for treatment for RSV is $6.6 billion per year. When someone's hospitalized, notice the average stay right now costing Medicare about $50,000. All right, and so again, very, very sad from death, of course, cost as well. And then notice the coverage, though, is also going to be covered by Medicare, but now we've changed, haven't we? Now it's going to be covered by that Medicare Part D plan. Part D plan, remember, can be standalone. If you get A and B with the supplemental plan, you have a separate or standalone Part D plan. It is going to be covered by the Part D plan, or if you enroll in an Advantage plan, it also has an included Part D plan, and then it will be covered. And again, same thing, zero cost to you as long as you see a Medicare provider, or if you're on an Advantage plan, you get that RSV shot from a doctor that would be within the network. Okay, so again, great coverage for the all-important RSV vaccination. All right, this brings us to the 6th primary vaccination, and that would be the shingles vaccination. Let's talk a little bit about that as well. Number 1, this is a health condition that is a painful skin rash. Those of you that have had this certainly would relate for sure. The skin rash is caused by the reactivation, notice the reactivation of the varicella, which would be the chickenpox virus that you had earlier in life. It can be reactivated. It's actually stored, that virus is stored in the nerves, and for some people it's reactivated. All right, and so that would be when you had chickenpox. This virus remains dormant in the nerve tissue and then can reactivate later in life. All right, so again, very, very serious, very, very painful. Complications from the shingles, we have what we'd call postherpetic neurology, which is PHN is the abbreviation for that, the acronym. But what this is that severe nerve pain. Terrible nerve pain that persists for months or even years, and sometimes for people the rest of their life after the rash is even gone. They say right now that about 10 to 18% of all people, even though the rash is gone, they're going to continue to suffer with this PHN. All right, that makes this vaccine very, very important. And then also you can have vision loss. They call this ophthalmic shingles. Sometimes those shingles get in the eyes, and when that happens, you can actually have vision loss. Some people even go blind because of this. Again, that's why we need it. And then neurological issues. This could be balance issues, just different things that are going to happen neurologically because of the virus. And then skin infections. These are the rashes that can really persist. All right, so very serious side effects of this. Expensive as well, $1 billion per year. I think this is very interesting. They say right now that there will be 1 million people, 1 million people. And most of those will be seniors that are going to be have a bout with shingles on an annual basis, new cases. And so right now we have a Shingrix vaccination would be the medication that is going to be used to treat shingles. Right now, retail is about $200 per dose. Okay, and that's why we're saying Medicare is spending out about $1 billion a year. And again, this is going to be covered by your Medicare Part D plan. All right, just like the RSV is covered by D, now we have a Part D plan. So that standalone drug plan or that embedded drug plan within your Advantage will cover this, again, at zero cost to you as long as you see a Medicare provider or stay in network if you're on an Advantage plan. Okay, I have just a few more to show you and then I'm going to conclude the video. But before we do, I just want to mention something about what we call the Medicare Essentials Workshop. We're dealing with a very important part of Medicare today, vaccines and the Part D coverage and Part B coverage. But there's a lot to Medicare. And so if you're just now beginning this journey, wanting to learn about Medicare, I would encourage you. What you can do is you actually can click the link that's below here and watch a workshop that I did, really summarizing Medicare, kind of big picture, get into kind of the ins and outs of when to start Medicare, when not to start Medicare, the different insurance options that you have. But we find that this is a very helpful tool. And so if you'd like to avail yourself of that, click on the link below because really this is everything you need to know about Medicare. The reason this is such a big deal, folks, is because before you start making Medicare decisions, as far as insurance decisions, you need to make sure that you go on Medicare at the right time, you're picking the right plan, and this will help you to really make those Medicare decisions mistake-free. Okay, now as we close this out, I just want to just show you just a few more vaccines that you may want to take advantage of to make sure you know exactly how they're going to be covered and the cost to you. And so the first one would be the Tdap. This would be tetanus, diphtheria, and whooping cough. Vaccine, again, is going to be covered by your Medicare Part D plan. Now, I want to emphasize something. Let's say that someone steps on a rusty nail and they just get a tetanus shot. Because there's injury involved in that. Actually, tetanus in that situation would be covered by Medicare Part B. But if we're just taking the Tdap as a vaccine, then that would be, of course, covered by your Part D plan. And now when it comes to hepatitis A, we saw this earlier. Remember, hepatitis A is going to be covered by Medicare D. But also, if you did remember we had that twin rig shot? Earlier we talked about this one. That is hepatitis A and B. And again, that would be covered by your Medicare Part D plan. All right, and then when it comes to MMR, this is your mumps, measles, rubella. This is going to be covered by Part D at no cost to you. Varicella, this would be your chickenpox vaccination covered by Part D. And then travel vaccines. Now, I want to emphasize this. Not all travel vaccines are going to be covered by Medicare. However, if the organization we talked about earlier, the ACIP, if they recommend to the CDC that this needs to be a vaccine that's covered, and it happens to be one that's necessary as you travel, then that would be covered by your Part D plan. And again, if it's recommended by them, there would be no cost to you whatsoever. And again, I'm not saying all travel vaccinations are covered by D because they're not. But if they're on the list put out by the CDC, then that would be covered by your drug plan. And then lastly, the rabies. And so what happens, rabies, this means that someone's been bitten by an animal that could potentially have rabies. This is actually going to be covered by B because it's due to exposure to that disease. Again, it's covered by Part B, just like if I stepped on a nail and exposure to rust, then that Part B would cover that tetanus. Okay, so those are going to be the different shots that you have coverage for if you're going to be on a Medicare plan, either standalone drug plan or Advantage plan, as well as Medicare Part B.